Hey guys, welcome back to my channel. So today I'm going to give you the new chapter or the new subject, Social and Preventive Pharmacy 8th semester. So this question I have listed out from the question bank of Social and Preventive Pharmacy, that is for 8th semester. So today I'm going to give you the second unit, 10 marks question and answers. So these are the questions which I have picked up from the question bank of Social and Preventive Pharmacy. So these are the questions. Write the general principles and prevention and control of respiratory infections and cholera, diabetes mellitus, malaria, cancer, SARS, and as well as dengue. So these are the questions which was asked in the question bank for the second unit, 10 marks. So I'll start by one. So the first question: write the general principles and prevention and control of respiratory syndrome and symptoms. So the definition for SARS: so it is a communicable viral infection disease with syndrome including fever and cough, and in some cases progressing to pneumonia. So the respiratory failure with new strain of coronavirus which differ in genetic structure to previous strain. So the causative agent for SARS is corona CoV, SARS CoV viruses. So the SARS CoV is one of the 36 coronaviruses in the family of coronavidae, and the source of infection for SARS: nasal route and throat secretion, an infected person or carriers, and the incubation period, it was said to be 2 to 7 days with the average and 3 to 5 days. So the symptoms for SARS are fever, dry cough, sore, breathing problem, headache, body ache, confusion and rashes, loss of appetite, and lastly diarrhea. So the breathing issue will appear within 2 to 10 days, and after a person is exposed to the virus, the health official will be contacted, and a person who presents the above symptoms and the family members, if they have the history of a foreign travel, so the person will quarantined for 10 days to prevent the virus from the spreading. So the mode of action or for SARS: so the SARS can spread when an infected person sneeze, cough, or comes into face-to-face contact with some other. So even caring of someone SARS who is the patient of SARS, and kissing, hugging, touching, or sharing eating or drinking utensils with an infected person. You can also contact SARS by touching the surface which is contaminated with the respiratory droplets from an infected person, and then touching your eyes, mouth, or nose. So the host factor for the SARS is humans are the big risk. Actually, SARS is a zoonotic disease which is seen in the wild and domestic animals including the bats. So bats are the common wild and domestic animals which are present in SARS. So in these, the animals doesn't show any signs or symptoms, but in human it may be mild to severe type of disease. So the control for SARS is the high mortality and morbidity rate which attributes to the SARS infection have long and been matter of a serious concern in all the countries. So treatment will be possible and prevention for SARS by the health organization authorities, which is decided to give the first priority to the problem of the intensity of efforts which is improving the primary medical care and services. So the prevention of SARS: to prompt identification of a person with SARS, their movements and contacts, effective isolation of SARS patient in hospitals, appropriate protection of medical staff treating their patients, comprehensive identification and isolation of suspected SARS cases, and simple hygienic measures such as hand washing after touching the patient, use an appropriate and well-fitted mask, and introduction of infection control measures, even screening of international travelers, and timely and accurately reporting and sharing the information with other authorities or the governments. So the second question, the general principles and prevention control of respiratory infection. So the acute respiratory infection is an infection which affect the normal breathing. It will affect your upper respiratory system, which starts at the sinuses and ends to the vocal cord, or lower respiratory system, which start at your vocal cord and ends to your lungs. So the infection is particularly dangerous for the children, older and as well as adults. So the people having disorders of immune system, and the causative agents, that is bacterial and viral, and the source of infection or the infective material through the nasal secretion, sneeze, cough or sputum, where the period of communicability days to several weeks. So incubation period, the normal incubation period for all the acute respiratory tract infection including the pneumonia is 1 to 4 weeks, and the host factor for the respiratory infection, which is more common among young children and as well as the elderly people. Even the environmental factor, poor air quality, active smoking or passive smoking, overcrowding, outdoors and indoor pollution, where mode of transmission for acute respiratory infection is airborne droplets, which is spread through the sick person, or cough or sneeze, which is inhaled into the lungs by suspectable person. So direct oral contact with someone who has pneumonia, and the count the breath in 1 minute, so 60 breath per minute in child is 2 month age, where 50 per minute or more in child 2 month up to 12 month, 40 breath per minute more than a child aged or 12 to up to 5 years. So the control of respiratory infection, washing of hands frequently, especially after coming from the public places, and avoid touching faces, especially eyes and mouth, to prevent introducing the germs into the system. Even avoid smoking. And lastly, try to use plenty of vitamins in the diet, such as vitamin C, which helps to boost the immune system. So the vitamin C is maintained in the immune cells, and a deficiency has been linked to the higher susceptibility to the infection, where the prevention and respiratory infection treatment, depending upon the severity of the disease, and disease can be treated at home or under the supervision of an expert doctor. And breath count is one of important tool which decides the severity of the disease. And lastly, antibiotics are given for the treatment purposes, where the prevention, the most causes of acute respiratory infection aren't treatable. Therefore, prevention is the best way to avoid the harmful respiratory infections, and the risk of the getting a respiratory infection can be avoided by giving MMR, measles, mumps and rubella, and preventive vaccines. So also the influenza vaccination and pneumonia are prescribed for the prevention purposes. So the third question, general principles, prevention and control of cholera. So the principle and the definition: it is an infectious disease which is caused by the V. cholerae and characterized by the intense vomiting and profuse watery diarrhea, and that rapidly leads to the dehydration and often lastly death. So the causative agent for cholera is Vibrio cholera 01 group, which is common for epidemic, and the mode of transmission which is contaminated food and drinks, fecal-oral transmission, and direct contact. The incubation for cholera is few hours to 5 days, but the average between the 1 to 2 days, and the period of communicability is depending upon the case or the carriers. There are various types of carriers are known as cholera, like preclinical carrier, convalescent carrier, healthy carrier, and chronic carrier. So they are the key in epidemiology of cholera transmission, where the host factor of cholera after all age group and both gender at risk. Gastric acidity is protective to individual, also economic status to play a positive role. Higher socio-economic status will have less problem. And the environmental factors, the contaminated water and food are the key sources of infection. Even open air defecation practices is favorable for contamination. Other factors are social factors, pollution, personal hygiene, and as well as poor education. And the diagnosis, so the clinical features are mild to severe, where the confirmatory test for cholera is done by the culture of a stool specimen or related to the rectal swab. Where the risk factors of cholera: rapid dehydration, acidosis, renal failure, electrolyte imbalance, renal failure, and rarely death. So the control of cholera among people developing symptoms of 80% of episodes are mild, and remaining 10 to 20% cases which develop severe watery diarrhea with the sign of dehydration. So the main tool for cholera to control, the enhance the hygiene and food safety practices, improve the communication and public information, improve the access to water, effective sanitization, proper waste management, and vector control. So the proper and timely case management in cholera treatment centers. Specific training for proper case management, including avoidance of nosocomial infection, where the sufficient preposition medical supplies for case management like diarrheal diseases kit, where the case management in that, number 1, ORS can successfully treat 80% of cholera cases, and appropriate antibiotic can reduces the duration of purging. Drink and use safe water. To be secure, water is safe to drink, and wash your hands often with soap and safe water. Use latrines or bury your feces. So the prevention for cholera, measures of the prevention of cholera may mostly consist of providing a clean water and the proper sanitization to the population who do not yet have access to the basic services, and health education as well as a good food hygiene are equally important. So the appropriate media such as radio, television, newspapers should be involved in the dissemination health education messages, and even the routine treatment of the community with antibiotics or the masses of has no effect to spread of cholera can have an adverse effect by increasing the antimicrobial resistance and have provides a false sense of security. Even the key points for the cholera health education aims at communities adopting the preventive behavior and altering the contamination. Vaccines, 2 vaccines are there. So question number 4, write general principle prevention and control of diabetes mellitus. So that diabetes mellitus is one of the metabolic disease which caused due to high blood sugar. It is commonly known as diabetes. The hormone of insulin moves sugar from blood into the cells to be stored or used for energy. With diabetes, the body doesn't make enough insulin or can't effectively use the insulin it does make. So the high amount of sugar present in the blood known as hyperglycemia and untreated high blood pressure for diabetes can damage the nerves, eyes, kidneys and other organs. So the types of the diabetes are, there are two types of the diabetes: type 1 diabetes, type 2 diabetes. So number 1, insulin dependent diabetes, and number 2, that is insulin independent diabetes. So what occurs in the insulin dependent diabetes? It occurs because the insulin producing cells of the pancreas beta cells are damaged in this type. So the pancreas make little or no insulin, so sugar cannot get into the body cells for use as energy. And the treatment for insulin dependent, it involves injecting insulin into the fatty tissues just under your skin. And for the type 2 diabetes, the insulin independent diabetes, in these the pancreas make insulin but either doesn't produce enough or the insulin doesn't work properly. So the treatment for insulin independent diabetes involves keeping a healthy weight, eating right, and lastly exercising. And the gestational diabetes, this is a high blood glucose level during the pregnancy. As the pregnancy progresses, the developing baby has greater need for glucose. So the hormone changes during the pregnancy also affect the action of insulin, which brings about the high blood glucose levels. Higher risk getting the disease, like over 35-year-olds, overweight, family history of diabetes. So the blood glucose level usually return to the normal after the childbirth. And the causative agent for the diabetes mellitus, a lack of insulin is a key condition for disease, but the cause for the same is difficult to identify. They may ranging from unknown pancreatic disorders like cystic fibrosis, defect in the formation of insulin, destruction of beta cell, decreased insulin sensitivity, genetic defect and atomicity. Even the host factor for DM or diabetes mellitus is age. So this is one age dependent disease. Type 2 is common older than age, and type 1 diabetes mellitus is more seen in the younger ages group. Sex, female or male are equal. Autoimmunity, obesity and the genetic markers, while the environmental factors like diet, malnutrition, excessive alcohol, viral infection and stress are the host factors. So the diagnosis for screening of diabetes or diagnostics of monitoring for diabetes mellitus are urine examination and blood sugar testing, where type 2 diabetes mellitus, fasting blood sugar glucose which is greater than or equals to 70 millimeter per 1 gram 126 mg per di. And the signs and symptoms for diabetes mellitus: increased hunger, blurry vision, weight loss, extreme fat, dry and itchy skin, increased urination, sores that are slow to heal. Prevention and control. Type 1, it isn't it preventable because it is caused by a problem with the immune system. So most diabetes prevention strategies involves in the making of simple adjustment to your diet and the fitness routine. If you have been diagnosed with the pre-diabetes, here are a few things you can to do delay to prevent. So type 2 diabetes, get at least 150 minutes per week of aerobic exercise such as walking or cycling. 2. Cut the saturated and trans fats along with the refined carbohydrates out of your diet. Eat more fruit, vegetables and whole grains. Eat smaller in portion. Try to lose 7% of your body weight if you have overweight or obese. Lowering the gut stress, limiting alcohol intake, getting enough sleep, and lastly avoid smoking. So the next question, principal prevention and control of malaria. So the malaria is an intermittent and determinant fever which is caused by the protozoa parasite which invade the red blood cells, and it is transmitted by the mosquito in many tropical and subtropical regions. So the causative agent for the malaria is Plasmodium protozoa malariae, P. falciparum, P. vivax, P. ovale, and P. female Anopheles mosquito, which bite to the human, and Plasmodia enters into the human body, which causes malaria. So the source of infection, the parasites are spread to the people through the bite of infected female Anopheles mosquito called malariae vector. So there are 4 parasites species that cause the malaria in humans are Plasmodium vivax, Falciparum, malariae, and ovale. So the period of communicability, gematocytes are usually appear within 3 days of the parasite with P. vivax and P. ovale after 10 to 14 days. So the gematocyte phase is the period when the malaria is ready to transmit from human to the mosquito. So mosquito needs to bite during this period, and the immunity. The epidemic of malaria is influenced by the immune status of population, where the incubation periods is during 12 to 18 days. The host factor for malaria, all the ages, newborn and infants are considerable. The infection with P. falciparum male more at risk compared to female. Individual with hemoglobin, sickle cell trait which have mild illness with falciparum, low socio-economical affected are more. Even environmental factors, season malaria season disease is most part of India, maximum prevalence from the July to November, and the temperature for optimum temperature for malariae parasite in the insect vector between 20 degrees to 30 degrees Celsius. So the mode of transmission for malaria, a single infected vector. During her lifetime, the malaria infects several persons. Direct transmission. Diagnosis by microscopy, the use of blood film searching, and the identification of malariae parasite. The complication for malaria, breathing problem, liver failure, jaundice, shock, dehydration, swelling, and lastly rippling of spleen, etc. So control for acute attack, the chloroquine 600 mg for P. falciparum resist to the chloroquine. So chloroquine quinine sulfate 600 mg 3 times daily for 5 days, followed by the single dose, and sulfur dioxin 1.5 gram with perimethane 75 mg. Prevention. So for prevention, spraying the insecticides, those are lethal and female Anopheles mosquito in epidemic area should be regular prophylactic drugs. Wear long sleeves and trousers for outside. Mosquito repellent cream and spray should be screened window in the houses. Use mosquito nets and burning of pythium based on mosquito coils. Vedak 6th question. Write a note on general principles and control of cancer. So the cancer may be regarded as a group of diseases which is characterized by an abnormal growth of cells, the ability to invade the adjacent tissue and even distinct organ of the death, and affected patients to tumor has not treated or may survive in the stage when it can be successfully removed. So the types for the cancer are carcinomas, sarcomas, and lymphomas. So the causative agent for the cancer, the causes of cancer are unknown. Many environmental factors which are playing role in the cause of cancer, like tobacco, alcohol, dietary fibers, occupational exposures, and some viruses, parasite, costume, habits, and lifestyle, and other like air and water pollution, radiation. So the symptoms for cancer: a sore throat that doesn't heal, change in the bowel or bladder habits, cough or hoarseness, unexplained loss of weight or loss of appetite, persistent fat, nausea or vomiting, unusual bleeding or diarrhea. And the diagnosis for the cancer is screening, self-examination, biopsy, X-rays, CT scan and MRI scan, molecular diagnostic test. where the treatment for the cancer, chemotherapy, which aims to kill the cancerous cell by medication, hormone therapy, immune therapy, radiation therapy, surgery, and lastly stem cell transplant, where the hormone therapy, radiation therapy, which can be used high dose of radiation to the cancerous cell, surgery, which is often for the cancerous tumor. Surgeon may remove the lymph nodes to reduce and prevent the cancer of the disease. So the prevention and control of cancer cells are primary and secondary. In that, primary control of tobacco and alcohol consumption, personal hygiene, radiation, immunization, food, drug and cosmetic safety, treatment of pancreas lesions, and cancer education. For the secondary prevention, cancer registration, hospital-based register and population-based on registries, and early detection of cases. So the treatment multimodality approach, where depending upon the severity and the stage of the cancer, the surgical removes the affected organ, and the chemotherapies and the radiotherapies. Where the tertiary prevention, it can be done with the prevention of complications, avoiding excess of sunlight, and many of the chemicals and toxins are excellent way to avoid the cancer. Where avoiding contact with certain viruses and other pathogens are also likely to prevent from some cancers. So even the vaccines are also present for the cancer. And then seventh question, that is hypertension, prevention, control and principles, general principles for hypertension. So the hypertension is also known as raised blood pressure for the long time, and ideal blood pressure is considered as 120 mmHg of systolic and 80 mmHg for diastolic. So in normal adults, the blood pressure is considered normal if the systolic blood pressure is less than 140 mmHg and diastolic blood pressure is less than 90 mmHg. So most of the having hypertension which does not have any signs or symptoms, because of the reason it is known as a silent killer. So the risk factor for the hypertension, two types of risk factor, non-modifiable and modifiable factors, where the non-modifiable factors include the age, genetics and ethnicity, whereas modifiable risk factors are obesity, salt intake, high intake fat, alcohol, low physical activity, and as well as stress. Even the symptoms for hypertension: severe headache, dizziness, fat, irregular heartbeat, nausea, chest pain, visual blur, and vomiting, shortness of breath. And even the prevention and control of hypertension are low prevalence, and hypertension in some communities indicates that the hypertension is potentially preventable. So even the population strategy and the high risk strategy, which is the prevention for the hypertension. And secondary prevention, primary prevention is defined as all measures to reduce the incidence of disease in the population by reducing the onset of action, where the population strategy, high risk strategy are needed for the prevention of hypertension. And secondary, the goal of secondary prevention is to detect, control high blood pressure and in the affected individual. Early detection is one of the example. So these are the prevention and control of hypertension. So the next question is dengue, general principles, prevention and control for dengue. So dengue is the most common and important arthropod-borne viral illness in the human, and the causative agent for dengue is caused due to the flavivirus with 4 distinct serogroups: Den1, Den2, Den3 and Den4. So it is a single standard RNA virus, and the host factor for the dengue, all the ages and genders are equally affected. Where the environmental factor, it is most commonly occur in the rainy season. So the mosquito is the key to transmit the viruses. So whenever the mosquito breeding is favorable, there are a high chance of transmission. And the immunity in the human recovery for infection. One dengue viruses provide lifelong immunity against the particular virus serotype. However, this immunity confers only partial and transient protection against the subsequent infection by the other three serotype of the viruses. And the mode of transmission, it is caused when the Aedes mosquito carrier the viruses bite a healthy person. Even the clinical prevention from headache, muscle pain, joint pain and bone pain, nausea, vomiting, eye pain, etc. So there are three types of fever a person is to the, namely mild dengue fever seen after a week, hemorrhagic fever worsened in the few days, dengue shock syndrome, so the death occurs. And the control and management for the dengue, so there is no specific treatment of dengue fever or cure. A dengue is a virus where a few basic treatments of dengue fever are: patient should be advised to stay well hydrated, fever should be controlled with acetaminophen and typhoid sponge baths, painkillers like quinine and paracetamol are generally prescribed to the patient, and IV drips and sometimes supplemented in case of severe hydration. And avoid like aspirins, anti-inflammatory drugs, aspirin containing drugs and other non-steroidal, so because there are the anticoagulant property. Even the administration of corticosteroids has no demonstrated benefit and it is potentially harmful to the patient. And prevention for the dengue is lesser skin exposure, so try to wear long pants and the shirts will cover your skin surface, reducing the chance of bite. So even in the evening, avoid venturing out and in those things. So here we have completed the questions and answers of Social and Preventive Pharmacy second unit. Tomorrow I am going to continue with the second unit of biostatistics. So please do like, share and subscribe to my channel.